It was the best of times, it was the worst of times. Charles Dickens' Tale of Two Cities. More applicable now, I think, than at his time. Since we started to really look at FM in 1999, in our brief retirement, it seems as though we saddled up and hopped on a meteor going faster and faster. Medicine has also greatly made some noteworthy achievements, which will help the FM patients and their families understand that the condition is established as real. We'll be comparing the progress of organized medicine versus alternative medicine, presenting ours versus theirs. The state-of-the-art comparison we hope to clearly demonstrate will give you choices, large and small. The proposed financial disaster of healthcare presented with smoke and mirrors, already 37th in the world's ranking before the grand dilution of services begins. In contrast, a system of unfailing principles of health started in the Holy Bible and developed using root answers, including dynamic and exact nutrition. We'll be showing you what that means. Prayer and meditation, herbs and hygiene, seeking the original causes of bodily, mental, and spiritual dysfunctions. Here are some of the eminent doctors presenting the orthodox state of the art.
Good morning. I'm Bill McCarberg. I'm founder of the Chronic Pain Management Program at Kaiser Permanente in San Diego. I'm also adjunct assistant clinical professor at the University of California in San Diego. Let's look at a case. 38-year-old female presents to the primary care doctor, overwhelmed, exhausted, aches all over, severe pain in her neck, upper back, trouble sleeping, forgetfulness. You're already worried hearing this history. What the heck am I going to do with her?
I'm Dave Williams. I'm from the University of Michigan. The Chronic Pain and Fatigue Research Center is located there.
I'm Steve Stanis. I'm a physiatrist. I work at the Rehab Institute of Chicago. I run an interdisciplinary program. It's kind of like a pain boot camp. Patients are sometimes there 4 weeks, 8 hours a day. It's hopefully I think as comprehensive as you can get for an outpatient setting.
In these presentations, you will notice that infections are not considered to be an important part of this condition. Early on, in '99, we made it a part of our FM diagnosis that at least 2 infections had to be present. Later on, we usually stopped counting at 6 because nowhere in the medical presentation is that an important part of their diagnosis, outside of including hepatitis C almost as an aside. We found that for 25 years we could find multiple infections while standard testing rarely did. We are also identifying and bracketing the bacterial biofilm being researched and studied. It should be obvious to you as we present this series that this is a black hole and a blind spot in organized medicine. How do these so-called latent infections work, and where do they hang out? Are they dangerous? Are they a factor in FM and other diseases? A biofilm is a structured community of microorganisms encapsulated within a self-developed polymeric matrix and adherent to a living or inert surface. Get the living part. A simple example is dental plaque and Streptococcus sanguinis, which we find spread throughout the body in susceptible individuals. Here is a picture of the growth and development of biofilm, which frequently occurs in the sinuses, mouth, lungs, heart, gallbladder, intestines, ileocecal valve, bladder, kidneys, and spine. Also in the cranial vault and the eyes. Here is a picture of an indwelling catheter with a biofilm formed by Streptococcus aureus. Today, the most common form of the drug-resistant MRSA, or drug-resistant form, which is the result of years of antibiotics use in the medical treatments of these infections. We will present in this series the evidence that it is at least, if not the most serious cause of over 1 million heart attacks and 750,000 strokes annually, which they throw billions of our dollars down the drain with no satisfactory results. We intend that you receive this information to give you hope and not despair. Our alternative doctors, using straight nutrition, adjusted to changing needs, so far have conquered, actually their patient's immune system has conquered, hepatitis C, B, A, MRSA, Legionella, drug-resistant difficile, drug-resistant tuberculosis, Pasteurella pestis, Epstein-Barr, cytomegalovirus, Lyme's disease, chlamydia pneumoniae, and many more bad actors. Remember, the best of times is also here.